Hello, I'm Dawn Kim from Jeonnam National University. In this video, I'll briefly introduce a design case on integrating procedural information into XR-based basic life support training. Imagine a simulation where you are learning to administer first aid to a patient experiencing a cardiac arrest. You are wearing an XR headset and a virtual patient has just collapsed in front of you. In this critical moment, what kind of learning support is provided and how? In this presentation, I introduce a design case that explores how procedural information can be embedded into XR-based BLS simulation to support learners in practicing life-saving tasks with instructional structure. Simulation-based learning has become an integral part of healthcare education. It allows learners to acquire and apply clinical skills in a safe, repeatable, and controlled environment, reducing the risk of error in actual clinical settings and enhancing learner preparedness. Despite advanced in simulation technology, instructional design considerations such as how procedural information is structured to support learning are often overshadowed by technical concerns. However, these design elements play a crucial role in shaping how learners engage with and make sense of procedural tasks in immersive environments. So, this study presents a design case that explores how procedural information can be effectively structured with an XR-based BLS simulation. BLS consists of structured, time-critical procedures. For learners, the goal is not only to recall steps but to execute them fluently under pressure. Achieving this level of automaticity requires repeated exposure to authentic tasks supported by instructional guidance. OCID model structures complex learning through four components: learning task, supportive information, procedural information, and part task practice. Procedural information serves as a key element in supporting learners as they carry out step-by-step tasks. In high-stakes, time-sensitive contexts like BLS, procedural information needs to be both clear and well integrated to support learners during task performance. When delivered in real time within immersive environments, such guidance can reduce cognitive load and promote the automation of essential routines. Applying this principle to XR requires adapting not just the content, but also how, when, and where procedural guidance is presented in the immersive space. In this study, the simulation was developed using Unity and MRTK for Microsoft HoloLens 2. It integrates digital procedural information with physical interactions using CPR mannequin, creating a mixed reality learning environment. The simulation followed a four-step BLS protocol. Each task was deconstructed into detailed learner actions aligned with national BLS guidelines. In this simulation, procedural information was structured into three forms: demonstration, just-in-time information, and corrective feedback. These elements were designed to support learners during task execution in real time, aligned with the principles of the OCID model. Demonstrations were delivered through an animated 3D agent accompanied by narration and auditory cues. Learners can move around space to observe the actions from different angles, thereby improving their understanding of physical positioning and procedural flow. JIT information was embedded as on-demand infographics that learners could activate via hand gestures. Each JIT unit conveyed a single rule or instruction, presented in a visually accessible format that remained stable within the learner's view. Corrective feedback was context sensitive. If a learner delayed or performed an incorrect action, special prompts were triggered. During physically demanding tasks such as chest compressions, corrective feedback was displayed beside the virtual patient in the form of a card, minimizing distraction while allowing learners to remain focused on the procedure. The design underwent expert review by specialists in educational technology and nursing. Their feedback led to refinements in procedural accuracy, the addition of auditory pacing cues, and improved post-simulation review functions. This case demonstrates how procedural information can be effectively integrated into XR environments. Technical factors are essential in shaping immersive learning environments. However, their impact is most meaningful when aligned with clear instructional intentions. This case highlights the importance of approaching XR simulation design from both a technical and a learning design perspective. This study presents a theory-informed design approach for XR-based BLS training. Future work will investigate how various modalities and feedback strategies impact the learning experience, thereby strengthening the connection between immersive technology and instructional design. Thank you for your attention. If you have any questions, feel free to contact us by email.